One of my roles as a dementia care specialist is to educate the community and help destigmatize dementia and Alzheimer's. By doing this, we hope that the people in the community can better be aware of the indicators of what Alzheimer's and dementia is and help them to be able to have better interactions with those people living with dementia and their caregivers so they feel safe and have a good interaction in the community. One of the ways that we do this is through the Purple Angel program, which is a program where I train businesses and organizations on being aware of dementia. You can tell if somebody is a Purple Angel trained because there'll be a purple angel on their decal on their window or their door. So if you're looking for somebody to help you when you're in the community, that's a great thing to look for. Another role I have is to support the caregivers, help the caregivers find the help that they need, connect them to resources in the community, whether that would be here in Oneida or within the county, because it's really important to be able to support caregivers and give them the resources so they can keep their loved ones in the community as long as possible. Having early recognition of Alzheimer's or other forms of dementia is really important because it gives the person living with Alzheimer's and or dementia and their caregivers time to make plans, time to figure out what they want their future to look at, whether that be remaining in the community or moving into a facility, and deciding what you want that to look like, and to have time to do things with your family and friends so you can have the best quality of life that there is. It's also really important to have the detection and get to a medical provider and get a diagnosis, because there are medications available, but they have to be given in a timely manner. So some have to be given early on, or like, as you just get diagnosed with mild cognitive impairment, or as it progresses into maybe Alzheimer's or a different form of dementia. And some of the medications are contraindicated for some types of dementia. So it's really important to know what you have and when you have it so that you can take advantage of the medications that are available for you. So some common forms of dementia would be forgetfulness, not wanting to socialize anymore just because it's too difficult to figure out all that noise and to separate that from that. So maybe someone who had been really social isn't social anymore. Problem finding words, repeating themselves over and over again, the same type of thing. Executive thinking, not being able to do things that they were able to do before. If you notice, like if your loved one is somebody who like always paid the bills and always was great at that, and you come into their home and you see mail everywhere and you see notices that their bills aren't being paid, something's going on. And that's a really important thing to just be aware of, if there are changes, and it needs to be a change. If they were never good at paying bills, you might not notice a difference, but if that was something they were, you're going to notice that. So this is really a good time to get somebody into a medical provider, because it may not be Alzheimer's or dementia. It could be something else. It could be that they have an infection going on. It could be that their medication is causing it. It could be they have a vitamin B deficiency, or maybe their thyroid is off. There's so many things it could be, so it's really important to rule those things out. And if you find out that they have something else, that can be fixed and they should go back to baseline and be back where they were. So it's really important to know those things. So to incorporate culture into my role, I always think about the community, the tribal community, and I'm always cognizant of Oneida's tribal beliefs and values, and prioritize the inclusion of family, as that's important to this culture. Oneida is fortunate that the state of Wisconsin finds it important that each tribe has their own dementia care specialist. So when I'm talking to a caregiver, the most important thing I want them to know is that it's okay to ask for help, and it's okay to ask for assistance. It doesn't mean that you're not doing a good job or that you're a failure. Everybody needs help, and to be able to help your loved one, you have to be able to help yourself. You have to make sure that your physical and mental health is at the best so that you can give your best to your loved one. It's also important to know that there are resources available and you need to take advantage of them, such as there is a memory cafe that we hold here in Oneida on the second Wednesday of every month from 1:30 to 3 here at the Oneida Health Center. And there is a support group held at Aging and Disability the third Wednesday of every month from noon to 4. So take advantage of these because it will help you to know that there are other people out there on the same journey that you are, and it's good to have support from others that are going through it. You're not in this alone. Another thing to think about is that some days are going to be rough and you're not going to be your best, and you may do something, you may yell or not be really polite to your loved one, and you're going to feel really bad about that. And your loved one is going to maybe be angry for the moment, but they're going to forgive you and they're going to forget. And so it's really important that you forgive yourself and know that we're not perfect and we all have bad days and those things happen. So take a breath, start over, and just go back to being the best caregiver you can be. If community members want to get a hold of me, you can call me at 920-869-4854 or email me at dmiller4@oneidanation.org.